Good evening, everyone. My name is Iman Johnson, and I'm the International Awareness and Involvement Chair for the Hinesville Alumni Chapter of Delta Sigma Theta Sorority Incorporated. And I would like to welcome you this evening to our World AIDS Day Roundtable Talk. Our sorority prides itself in being one of the front runners in awareness and bringing attention to issues that disproportionately affect Black women and the African American community as a whole. Black women account for 60% of new HIV infections, and while African Americans make up only 13% of the US population, they account for over 40% of new HIV infections. HIV/AIDS affects Black and African American communities more than any other racial or ethnic group. Thus, one of the reasons we're here tonight to commemorate and celebrate World AIDS Day. This day takes place on December 1st each year and is an opportunity for people worldwide to unite in the fight against HIV/AIDS. Globally, there are an estimated 38 million people who have the virus and more than 35 million people who have died of HIV or AIDS-related illness, making it one of the most destructive pandemics in history. World AIDS Day is important because it reminds us and the government that HIV has not gone away, and there is still a vital need to raise money, increase awareness, fight prejudice, and improve education. Our speakers tonight will tell us their personal stories as well as enlighten and educate us on how far we've come, where we are now, and where we're headed in the future in the fight against this impactful disease. At this time, I'll turn it over to Mrs. Janice Hill, our chaplain for Hinesville Alumni Chapter, for our invocation. Thank you.
Let us pray. Most gracious and most heavenly Father, oh God, we come to you tonight, oh God, thanking you for this opportunity, oh God, that we're able to come together, oh God, to learn and to know more about the things that affect us as a community. Lord God, we recognize that World AIDS Day was organized for a specific reason, oh God, and we thank you, oh God, that we're able to reach out and touch those who have been affected by this disease. Lord God, we pray and we ask right now that we would open our ears, our hearts, and our minds, oh God, that we might be able to understand more, to help more, oh God, to be able to be a light in our community, to do that we've been sent to do. So as we come together tonight, oh God, let us be mindful of those who have been affected, and let us learn ways that we would be able to help those in our community, to reach out, to bring them in and let them know, oh God, that you are concerned about everything that concerns us. So Lord, we thank you, we praise you, we magnify and we glorify you. And we ask all these things in the name of Jesus, we pray. Amen.
Good evening, everyone. I am Cynthia Smith, and I am the Hinesville Alumni First Vice President and Program and Planning Chair. I am tasked to bring you the greetings today from our illustrious organization, and to welcome each of you to today's Roundtable Talk discussion. It is our intent that you leave with a very informative and rewarding answers to any probing questions that you may have. And again, welcome. Do not be afraid to ask any questions. Ask the question, then get the answers that you want. I will be followed by Latasha Johnson.
Good afternoon, and thanks for joining us tonight. I have the distinct pleasure and honor of introducing our speaker for tonight's occasion. She is none other than Ms. Andrea Moon. Andrea Moon is married and has 2 children. She's worked in public health for over 20 plus years. Ms. Moon has started her specialization in HIV in 2001. She's a nurse practitioner with the Chatham County Health Department, but her focus is at Chatham County Care Center. Ms. Moon has a wealth of knowledge. She served in several different capacities at the health department, some being the nurse specialist, a nurse manager, as well as a clinical trial coordinator. Followed by Ms. Moon, we'll have a special guest that will come forth and share her story at the time permitted. She had a prior engagement, as she's always an awesome World AIDS Day speaker, and she loves to share her story. That is none other than Ms. Shakita Kennedy. She's a native of Savannah, but lives in Effingham County, which still is a part of our coastal district. Without further ado, I turn it over to Ms. Ashley Quick, who will be the moderator for tonight. Thank you.
Good evening, Ms. Moon. I'd like to start with you. Can you talk about what it is to have HIV and how it differs from having AIDS?
Good evening. Yes. First, thank you everyone for inviting me. Thank you, Latasha, for that introduction. I did want to start with a little bit about how I got into HIV care and then go to that question. So as Latasha said, I've been a nurse at the Chatham Care Center for 21 years. I was actually pregnant with my son when I came there. And I was actually supposed to work in child health. And when I applied for the position, the HIV specialist nurse was there and she hired me. And so being pregnant, I was really nervous about, working in an HIV clinic. I even kept it from my husband for a while because it was just crazy. But I really thought, because I guess I was pregnant and my hormones, that I wasn't going to be able to do it, because at that time in 2001, clients were coming to us very, very sick. They were sick, and just the emotions of it, I was like, oh my God, are they gonna make it? And I was like, I don't know if I can do this every day with it pulling on my emotions, but I pushed through and was able, and I'm so glad I did, because it's a very rewarding, because now I get to see some of those same people, some of those same patients that have raised kids, raised grandchildren. So I've watched them for 2 decades thrive and live their life. So I thought that was important to share, because we think we know, I thought I knew, and then when I got there, I had no idea. So HIV is the virus that caused AIDS. So there is a difference. HIV is human immunodeficiency virus, and it's the virus that can cause AIDS. If persons with HIV do not take care of themselves, it can progress to AIDS. So similar to how coronavirus can cause the COVID-19 infection, HIV causes AIDS if we don't take care of it, if we don't treat the virus.
How is HIV transmitted?
So it's transmitted through bodily fluids, but specific bodily fluids. So if you drink after someone in a cup, you can't get it that way. Blood, semen, so sexual contact, IV drug use, and then mother to baby. But I will say that mother to baby, those numbers have significantly decreased. And that's because OBGYNs are testing women while they're pregnant. So they're able to catch women if they're positive and unaware of it. They're able to catch it early in the pregnancy, get them on medication, get them suppressed, and then the baby's negative. And also the advancement of medication. With the advancement of medications, women are able to not have significant side effects from the medications, and they're able to lower their viral load, and then they can't transmit it to the baby. So just real quick, when a person is diagnosed HIV positive, a couple of things that we're really concerned with are the immune system, because that's what HIV does. It attacks our immune systems, and so you want the immune system to work to function correctly, to be able to fight off infection. And so and then the other thing that we look for is a viral load. If you have HIV, you'll have a viral load. And so when the numbers are decreased for the viral load, it makes it difficult to transmit. And that's the important thing with mother to baby, and even from in sexual contact. If we can get people to get on medication, take their medication, and suppress the virus, then it's difficult for them to pass it on to someone else.
So I'm going to back up a little bit because there's a two-step process to getting your diagnosis. So can you talk a little bit about how to get tested and how do we determine that someone has HIV and or AIDS?
Okay, unfortunately, for some people, they may not have symptoms when they become exposed to HIV. Some people will have a rash. Some people will just feel like they have the flu, and they won't be alarmed. They'll move past that moment and just think they had the flu, keep on going. So that's one thing about the virus that puts you at a disadvantage. So unfortunately, for a while, people may not, unless they become a contact or they have, or they're just really in tune to their health and they want to get tested, you can go around for years and not even know that you're positive. So that's one thing that could be a disadvantage. There's HIV testing, there's free HIV testing at the health departments. You can actually get a kit to test yourself. So the first thing you do is you get the HIV test, and they always want to do an additional test. You want to make sure, because there's a screening test, and that screening test is very sensitive. So different things can make it become positive. Being pregnant can actually make it positive. So you want to make sure that you always get a confirmatory test. So that's the two-step for HIV. A person can have HIV for years and not develop AIDS. Okay, so an AIDS diagnosis is when a person has been HIV positive for years, and then their immune system is weakened over time, and they can come in contact with viruses, infections that they normally would be able to fight off, but they can't. So sometimes I can't get rid of this cold, or they go to the hospital with pneumonia, or a woman may have a pap smear that's always been normal, and then all of a sudden she has invasive cancer. So that's because the immune system can't fight off the infections, and then those illnesses, if their CD4 count is a certain number below 200, then they'll be diagnosed as AIDS.
Can you talk about CD4 counts for those who may not be familiar with what that is?
Sure. Everyone has a CD4 count. Everyone. I mean, we have, but we don't, our immune system works pretty good, so we're not worried about it. But when you become HIV positive, it becomes one of those lab results, lab values that you become very concerned with. So everyone has CD4 cells, and they are what keeps us from getting sick. It's what fights off infection for us. So we want that number high. We do, a person with HIV does. No, normally you don't even know what your CD4 count is. But when you become positive with HIV, the virus attacks our CD4 cells. It's a very smart, stealthy virus, and it tries to take your immune system out. And so CD4s, normal CD4s, we want it over 400, but some people just live at different numbers. Anything less than 200 is diagnosed as having AIDS. And CD4 counts can go into the thousands. And so everyone has where they kind of live with CD4 cells. And so, but the more we have, the more we're able to fight off. So when I talk to my patients, I describe it as having an army. The more men you have, the more you're able to fight off infection. You don't have that many men, you become more vulnerable to infection. So I try to explain it like that. So you want that number to be as high as it possibly can. Everyone is different. Some people, they live in the 700s, some people live in the 400s, but if that's where they live, they're comfortable and they're not getting sick, then that's what's normal for them.
So once somebody receives their diagnosis here in the coastal area, typically where are they being treated at?
So if someone is test positive here, we refer them they can be referred to us, to Chatham County Health Department. We have a satellite site in Glenn County, as well as in Liberty County. So we do have some in the lower counties if they aren't able to come to Savannah, but also infectious disease doctors will treat clients as well. But a lot of our clients will come if they need assistance in terms of not having insurance, or because we are federally funded, state funded, and Ryan White funded. And so when you're Ryan White funded, you get federal funds that can help clients get on medication. And actually, with the Affordable Care Act, we're actually able to let them get insurance, which is very important for our clients, because with the advancement of medication, clients are living longer. They're dealing with HIV, high blood pressure, diabetes. They're living long enough to have chronic illnesses. So it's important important that we get them connected with insurance so that if they need to go to a specialist, that it can be paid for, taken care of, and it just treats them as for the whole client. So Chatham County Health Department, but clients can also be seen by infectious disease physicians as well.
So these antiviral medications can be very expensive, and the regimens can be kind of complicated, even though they have improved over time. Can you talk about what is the current treatment standard? We'll use the word standard for current patients.
Okay, so I have actually been fortunate enough to watch this evolve. So when I started, they were like, you had to be on 3 drugs because the thought process was we needed to hit the virus at different points. And so you had to be on 3 drugs. That was it, at least 3. And some of the regimens were 2 pills twice a day, 1 pill twice a day. And now we've grown to where it's still 3 medications, 3 or 2 medications now actually, but it's 1 pill once a day. And I've watched the side effects go from nausea, vomiting, diarrhea to very minimal side effects now. The most common side effect now is fatigue. They feel tired. And so we get them to take it at night, sleep through it, and they do beautifully. We even have now long-acting medications with the injectables, and that's the new thing. But as you mentioned, they're expensive. So a lot of insurance companies haven't gotten on board with them quite yet, but they're injectable. So they come in every 8 weeks, get their injection, and then that's it. And it's really changed the game for some patients because of compliance. Some clients, you think 1 pill once a day, you can do that, but it's a couple of things. One, some of our clients, they have other challenges. They're trying to figure out where they're going to live, how they're going to eat. So, taking a pill once a day is really on the low on the totem pole. And other things is I've talked to various clients, and some of our clients, even though they may have been positive for years, they have a sorrow. They attach being HIV positive with their HIV medicine, which makes sense if you think about it. And if you take your blood pressure medicine, I have blood pressure, I take my blood pressure medicine. But when they have HIV, they relive. It's like for some patients, it's a grief process. They relive having HIV. They relive things that they feel like they've lost because of HIV. A young woman diagnosed young, can I have kids? It's like reliving that every day over and over again. And so the longer I've been in, I've come to appreciate that it's not as simple as 1 pill once a day, that, you have to kind of meet them where they are. So I think that the long acting medications is going to play a major role. Being in clinical trials, we're now in the process of looking at a medication that may be every 6 months. And can you imagine every 6 months, not having to, just come every 6 months, twice a year, get your shot and go about your life. So I'm excited about, being a part of that, to see the growth of the medication and how it's better patients' lives.
As the drugs have improved, patients' lifespan with having the disease has improved as well. So what is the current average lifespan of someone who is diagnosed with HIV?
Actually the same as you and me. It's the exact same, which is awesome. So for men, 75, for women about 80. But the difference is that there was a study about 2 years ago that clients or persons with HIV, they live just as long, but they get chronic illnesses sooner than you and I will. So if we live to 80, then 15 years earlier, they'll start having their chronic illnesses will start earlier. So let's say, for instance, we live to 80 and our chronic illnesses start at 70, theirs are going to start at 55. And it's the effect that the virus has on the immune system. So even though the medicines are working, the virus still tugs on the immune system. It still affects the cells. It causes increased inflammation. And so although they're living longer, they may have to deal with chronic issues earlier than persons that are HIV negative.
You mentioned clinical trials. Are they working on a vaccine, and how close are they? Do you know?
So we are working on a vaccine at our site, and they are working on a vaccine, but the vaccines that they're focusing on now are really for clients who are already positive, because you got to think, if we're talking about a vaccine, HIV negative people may not want, I mean, I wouldn't want you in, having to introduce anything into me that may, you don't know. So clients who are HIV positive, there's a vaccine to help them suppress the virus. So it would really be for clients who are already positive. And they, sometimes we think they're close and then something happens and then it just seems longer. So you never know, because sometimes, just like with COVID vaccine, wasn't around and then they were able to move quickly with it. So you never know, it may just be a breakthrough like that, but it's been in the works for years. So
let's talk about how to stop the spread of HIV.
Education. And again, you would think at this point, but it's still, because one of the highest growing HIV positive populations are young people, 18 to 24, men that have sex with men. So there's still some education to be done. So the highest growing is African American, men that have sex with men, 18 to 24, and then 24 to 35. So we still have this segment of the community that we're not reaching, that we're not getting to, and so education is one. Knowing your status, that is so important. Knowing your status, not being afraid, getting the test, understanding where you are, because you're not going to because you're going to just continue to spread the virus if you're unaware of your status. And then you're also engaging in risky behavior. So education, knowing your status, when you do know your status, getting on medication, being honest with people, being upfront. And if you get on your medication, once you're on your medicine and you're undetectable, it becomes extremely difficult, less than 5% that you could actually, even lower than that you could actually transmit it. So if you can get undetectable, know your status, get on board, take your medicine, then it becomes untransmittable. It's difficult to give it to someone else. And so, and also if you are dating someone that's HIV positive and and you're negative, or if you are engaging in risky behavior, there's PrEP, there's pre-exposure medication, pre-exposure prophylaxis medication that you can take to prevent yourself from becoming HIV positive. So there are ways to prevent it. And actually the HIV numbers have gone down. They've been a trend of lowering each year. And we thought last year with the numbers being down is because of COVID, but they've come down again this year. So we're thinking that we're making strides with the PrEP and with knowing your status, taking the medication, and lowering your viral load so that you're not able to transmit it to others.
Thank you. Ms. Moon, is there anything that you could think of that would be beneficial to share with us that I didn't ask you specifically?
I think that knowing your status, but also just taking good care of your health. I think that is important as well for our clients. I think that when we first started with HIV, it was taking medicine, get them on board, taking medicine. And, there just was like an assumption that HIV was what was going to be their demise. That was the assumption. And now they're living to see grandchildren. They're living long enough to have high blood pressure, diabetes, the problems. So we have to now shift the focus so that they're taking care of themselves, the whole body. You take care of your HIV, but we need to eat right. We need to make sure that you're exercising. We need to make sure that, if you have to have a family history of prostate cancer, that you're getting your screenings done. And I think so long the focus was on treat the HIV, treat the HIV, treat the HIV, that they just figured the rest of it would just, they wouldn't even live long enough to have to deal with that. And they are now. And so we have to make sure we have to retrain our thinking and make sure that they're taking care of the whole body, or taking care of themselves. I think that stigma still exists. I think that, and even if it's not as bad as it was, but each patient, that stigma still exists because they don't, some people don't have anyone that they can confide in. And so they hide, and they're uncertain, and they're afraid of how people are going to view them, and the judgment. And so stigma still exists. It's not, I don't think it's as bad as it was, but stigma in that patient's mind is still real. Even if, even if we feel like the world has come and we've evolved, if that person still feels how they feel, it's still valid for them. So I think that we just meeting people where they are. I still have clients who they have to come early in the morning. They don't want anybody to see them. I bring them in the back door, and I don't mind, because I think it's so important that we sympathize with people. And I always try to not say I know how you feel, because I don't. And I'll tell them that first. I'll say, I don't know how you feel, so I'll meet you at the back door, because I'd rather them come to the back door than not come at all. So we have to really meet people where they are, be willing to listen to them, to let them have a voice, to value what they think, and just to reassure them that, if you can get on board, this won't be it. I mean, you might get hit by a bus, but this won't be it. The things we can't control, let's control them. And I just think that forums like this are so important, because just the information that the international chair shared about the numbers, and about, for the longest, African-American women were the highest ranked, because just because of communication, I think, because communication, people not wanting to be judged, men being on the down low, women thinking that they're in a monogamous relationship and they're not. So I think, we still have a lot of work to do, and we have a lot of information to give, and just communication, just understanding what we're dealing with, that it doesn't have a look. You can't pick out somebody that's positive. You don't know, you have no idea. So I think we just have to, as a community, embrace one another, their differences, continue to educate, talk to your children. Don't make any assumptions. Talk to your children. Let them be able to talk to you. Let them be able to be honest with you, not tell you what, you think you want to hear, but let them be honest with you. Because like I said, 18 to 24-year-olds, can you imagine, 24, 18, you think your whole life is still ahead of you, but it still changes things. It's still, you have to now think about taking medicine every day. Think about, if I wanted a family, what that's going to look like. Those things are still possible, but let's do the education. Let's listen. Let's educate not just our kids, but children in the community, children that don't have that base, and just be a community. I think we, as African Americans, may have lost that somewhere along the way. So I think that's it.
Ms. Moon, you have given us a wealth of information, and we appreciate you. At this time, I'm going to open up the floor to any questions that anyone may possibly have. You can enter them in the chat or take yourself off mute.
Hi, again, thanks, Ashley, as well as Ms. Moon. Your information is outstanding, and we really appreciate it. To piggyback off a couple of things that Ashley mentioned before, when she talked about payment plans and how are clients affording medications, I think it's important that we share that there are ways for patients or clients to have access to medication. They have programs via the state, our ADAP program that supplement costs for patients, as well as some of our pharmaceutical companies and our drug programs. They have different co-pays, but insurance is important. But if someone doesn't have insurance and you know that they need to be in care, please refer them to a Ryan White clinic. And we have Ryan White clinics. We have 159 counties in Georgia, and we have 18 health districts. So even if someone don't want to come to Savannah, we have outlying counties that have Ryan White clinics who, if they need to get into care, we can make sure that those individuals get into care and that they receive the medication and the care that they need so that they can continue to be virally suppressed as well. I think our next speaker is trying to log on. As soon as she log on, I'll notify you.
Thank you, sister, oh, my sister, Miss Johnson. But I think that's important for everyone to understand that that access is available, that there is assistance, and a lot of times you know, they may not have to pay a copay at all. So I think that's important, that help or assistance is available. So.
We do have a question that came in the chat about if you all are still doing fairs at the colleges.
Well, COVID kind of changed things. We were, that was like one of the standing things that we would go out to different colleges. So I think with coming out of COVID, you may see where we are able to come out more. Is she interested in someone hosting something?
Hello, Sarah Moon. This is Sarah Harris. I was just wondering, because I do work at a college, and I was wondering if different fairs are still being offered, and if someone wanted to have a fair offered at their place of business, what would they do? How would they contact you? And that's a thing that's how it gets started. How would that work?
So we actually have educators, and Latasha is actually one of them. So you would reach out to them, but I mean, you could contact us and then we can make that connection. But Latasha Johnson would be a good resource for that.
Thank you, Ms. Harris, for your question. As Ms. Moon stated, we do still have health educators within all of our health departments and counties. And if you're interested in having someone at your college, I know that we have some connections in Waycross, because that's still part, I mean, in Brunswick, I'm sorry, because that's still part of the Coastal Health District. And I have one of our health educators, I'm not sure if she's on, I'm sure she's on, but I don't think she can unmute herself at this time. But you can send us your information, or you can put it in the chat and we'll make sure she gets it. If you're interested in someone coming to your college, we'll be more than glad to at any time.
Thank you so very much, Sarah Johnson.
You're welcome.
Ms. Moon and Ms. Johnson, also, not only do you all offer the testing at colleges, anyone that may want to have someone come to their church or family reunions, as a former educator myself, I know we used to do testing at churches. Some people would request us to come to family reunions, different like ladies gatherings, ladies night, things like that. Do you all still do those types of things too?
Yes, Ms. Johnson, yes, we do. I mean, the health department still do those. Again, it had been halted because of the pandemic, because of COVID. However, they're readily trying to get back into the communities. So again, if there's an interest with anyone, or someone wants someone to come out, you can contact the health department. If you don't know who to contact, if you can, again, reach out to me. We'll put Ms. Moon's email address in the chat as well. She's at the health department and she knows how to get in contact with many other health educators as well. We can, and the social services techs, or whoever it is, wherever you are, whether you're in Effingham, Brunswick, Waycross district, I even cover Valdosta district. So with anywhere within the 159 counties in Georgia, we can make sure that we can get out to wherever you are. It's not just an Atlanta thing, and that was one of the things that many had focused on before, because sometimes it's, as Ms. Moon stated, it's very stigmatized in our rural areas. As well as, I think you asked about the churches, and Ms. Harris, someone was actually at your college today. So someone went out to today at your college to actually do some testing there as well.
Yes,
So
yes, I knew that. Thank you so much.
You're more than welcome.
Any other questions?
I have a question. Has anyone in the panel ever had an HIV test done before? Has everyone been tested before? I will say this. I felt pretty confident when I was like, I think I'm positive, but my nerves were so bad. And it's like, because when you think about it, do we really know? I mean, if you think about just, because I look at clients and I like, that could be me, that could be me. And so that could be my daughter, that could be my sister, that could be my brother, my cousin. And, I just say by the grace of God that, that we aren't positive. So it just, oh, the anxiety. So, so I can understand why some people, may be hesitant to get tested. If you think back, you're like, oh, Lord, I feel fine. I feel fine. I feel fine. And you convince yourself. So, but it is, and I see what people are saying, they get tested, every 2 years. So it's important to just kind of have, a baseline, kind of know where you are. But it could be very, very stressful getting peeking at it, so just imagine, clients when they come in. So
We have a question that came in on the chat about barriers to educating in the school systems.
yeah, so so some of it is because it was also a barrier to me with the church, because when you go, we're to talk about abstinence. And so that could be a barrier because the number one way is sexual contact. And so I know we had talked about doing HIV testing at my church, and you think about schools. And then one of the things you want to do is when you assess someone's risk factors, then it's my place to now talk about condoms because they're having sex. So I need to talk about condoms. And then abstinence, and condoms. And so that was one thing. And it was like, to know that they have this risk factor and not address it is shame on me, because if they're having sex and they're okay, yes, we want you to be abstinent, but I also want you to protect yourself. And so that's the tough conversation that we have to have, the conversations that they necessarily don't want us to have in schools, and the conversations that we can have the conversation, but we couldn't hand out the condoms. And so it's like knowing someone has a blood pressure problem and not addressing the problem and not offering a solution. And so so it becomes challenging, but I still think it's important because the kids are having sex younger, so that means there's more exposure earlier, and the thing is that we don't know who they're coming in contact with, and the first time, I mean, you think about it, we're mostly women, but anyway, the first time a girls have sex, the exchange of blood right there opens them up to being exposed to HIV. And so we have to really think about these things and really educate our girls, our guys, that you've got to protect yourselves, and yes, I don't want you to have sex. I want you to wait, and it'd be great if you wait till you got married. But if we're going to be realistic, I need you to use condoms. And so that's some of the challenges with going into schools, with going into churches, is that, they need the information, but they need all of the information. We can't just pick out pieces. We need to give it all to them. And not encouraging them to have sex, but if you're already having sex, are you really, we have to, it's like, like when I talk to somebody about smoking cigarettes, you may not be able to stop all the way, but if I can get you to cut down to 5, so you may not stop having sex, but if I can get you to use condoms all the time, then I need you to be as safe as I possibly can get you to be. So that's some of the challenges.
Are you all treating minors at your clinic or just adults?
We do not treat minors. There's a pediatric immune specialist, infectious disease specialist that treats minors, and then when they become older, they come to our clinic.
If I could also piggyback off of the question from Ms. Howard in regards to the barriers, there are sometimes a lot of barriers within our schools. I currently live in Bryan County, and they often have career day. And so when they have career day, you can go and you can speak and you can, but once, when I did it, when my kids were in school, I was asked not to come back after I went because HIV is in my title, was in my title at the time, although I didn't promote condoms. So there are some barriers. So there are some things that we still have to work through to get into some of the schools. Some of our alternative schools don't have a problem with it. And I know we don't have this school here in the area anymore, but it used to be Scott Alternative School. I'm not sure what the backup is, but we used to have a program there that actually did a lot of health education, sex awareness, and HIV awareness within the school system there as well. However, I know in Bryan County, we have to be very conscious as to how we talk about it, but there are some ways that we do, that health educators do try to get through to clients or to people and to schools. It's just, we just have to be more creative when we do it. And I think there was another question that came across.
There is another question, and I'm going to change it just a little bit. So if you're with a partner that has been diagnosed with HIV, what is the recommendation for the non-infected partner as far as having intercourse, using condoms? What is the current recommendation?
So if you have one partner's positive and one partner is negative, okay. So one, the partner that's positive, making sure that they're healthy, that they're undetectable, on medication, taking good care of themselves. The person that is positive, making sure that they're tested routinely, making sure that they're offered PrEP, because it is an HIV medicine, so you have to also take in consideration is the side effects for that person that's HIV negative. But you would offer them PrEP, encourage PrEP actually, and just and routine testing, stay as healthy as possible, routine testing. I have clients who, the woman who's positive, the man is negative, she has been suppressed for years. They've gone on to have children. They use condoms. He has not been on PrEP, but so really, if the person that's positive can get undetectable, it decreases the chance. I still recommend condoms. I still recommend that they get PrEP if they're comfortable with it. But it's a conversation, and I will bring both of them in. We'll bring our patient and their partner so that they're both hearing the same information, so that nothing is being hidden from anyone, that everybody is up front. We understand what we're doing. This is our game plan. And it's about making sure that patients are on board. Because we can't say you should do this, and this, and then they walk off and do what we say do. So we have to include them in the plan because it's their lives. It's it affects them daily. So we have to make sure that it's a plan with all of us. Okay, so you're not going to do this, so let's do this. And we have to make sure that the end goal is that everybody's healthy. But it has to be a mutual plan, a plan that we make suggestions, and then they say, okay, we can do this, and this.
Now, the PrEP medication, is that a single dose medication or an injectable?
It's actually, it can be both. It can be a single dose, and the injectable has newly been approved for PrEP.
Okay. And here in this local area, if somebody wanted to obtain that medication, where would they get it from?
So we actually do have a PrEP clinic on Drayton Street, if I'm not mistaken. I can get the information, but we do have a PrEP clinic. And so whenever we try to promote it the best we can, but we definitely, if we have clients who we know have negative partners, we refer them over there, or even clients who come in for HIV testing and they're found to be HIV negative, then we refer them as well. Because if you had a concern, then we need to make sure that you're educated as much as possible, and we'll refer them as well. And I actually had a new patient Wednesday who went to start PrEP, but he was positive when he went. So so it's just that he was just negative, and contact in between there, and now so we education, and he knew, just waited too late.
And
but
I
he's gonna
think
be
you
fine.
might have touched on this earlier, but just to reiterate that it can take how many months for after you have a positive contact, even years, but how many months where they're doing like the prophylactic to see if your test is going to be positive?
So, okay, so so the window period, those people were never tested. So it doesn't take that long to actually for your test to become positive, if that makes sense. So we call it seroconverting. So if someone can take a positive test and then never get tested and become positive in that time frame, and it can be positive for up to 10 years, but their test would be negative. Because that's kind of like a confusing phenomenon. So you come in, you're HIV negative, and you never get tested again. And then maybe 10 years from then, you become positive. Somewhere in there, you became positive. If you had gotten tested in there, it would have showed you a positive. But our bodies are amazing because our immune system just keeps trying to fight it. It just keeps trying to fight it. And eventually it just gets worn down. And that's those clients who just come in sick from something else. But if you test negative, excuse me, then we have you come back in 3 months and test again. So that gives you time to, if you have contact, it gives you time to, if your body's going to seroconvert, it will, and then we'll test you again. So clients who who have positive partners, we have them come every 3 to 6 months, just depending on if they're using condoms, if their patient that's positive is undetectable. So it just kind of depends. But it's not a theory of where HIV will lie dormant, and if you test, it won't show. That's not it. Does that make sense? Okay.
All right. Thank you, Ms. Moon, so much. I'm going to close our Q&A at this point and turn it over to our president, Janice Baker-Lane.
Well, good evening, everyone. I just want to thank you all for joining us this evening for our roundtable discussion. Special thank you to Miss Andrea Moon for all your insight, your expertise, and everything that you shared with us this evening. Thank you, thank you, thank you for just making this comfortable. Thank you for sharing your heart, and thank you for being so passionate about what you do. It shows when you speak. It really does. It shows when you speak. So everything from the CD4 count to where we go, medications and regimens, and how far our medications have come, and just where science is going with our vaccination, it all has been helpful. And I think we all have a challenge tonight. So I want to extend my thank yous to our physical and mental health, and as well as our international awareness committees for putting this together and making this go so very smooth, and our technology for putting this together as well. 34 years, I think, ago, in 1998, we began to observe World AIDS Day. And I think I appreciate you all being here to help us unite, to just be knowledgeable about the ending of HIV and remembering those who have lost their lives to AIDS-related illnesses. I hope tonight has been a teacher, and that we can all take something with us to share with somebody, and we can all be challenged to at least go take a test. Those comments in the chat, I felt like some of you, like, I've always been nervous about taking a test, but I think it's important that we challenge ourselves, and together we do it at just, to mark today, and be, just be in the fight with everyone else, and to know what it feels like to actually have to go through it. We may not know what it's like you said, Ms. Moon, but we can all put ourselves out there and try to know our status. And I think that's very important, to know our status. And thank you all again for being here tonight, and share this information, and don't keep it to yourself. And I think that's most important. So again, thank you. Have a great night. And we look forward to you supporting Hinesville alumni again in the future. Thank you so much. Good night.